sleep with everything going on. So it's important to know that there is a place, but we're going to concentrate today on what we can do at home to prepare. And if you did have to go to a shelter, we're going to talk in a minute, right after we come back from break, what are the necessary items to take with you if you leave your home to go either to a shelter, to a hotel, or even to a friend's house. So we'll be right back after this quick break with more with Dr. Karen Gilbert.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to CareGiver Solutions.
We're back, and my special guest today is Dr. Karen Gilbert. She's with Alzheimer's Community Care. She is a certified dementia practitioner, registered nurse, and with many, many years of experience helping families going through the challenges of caregiving when it comes to Alzheimer's and other related dementia. So, Dr. Gilbert, we're talking about the hurricane, the pandemic is causing more threat with those two issues together. But if someone did have to leave their home, if it wasn't safe, if they were in a flood zone or a mobile home or whatever the reason might be, and whether they go to a friend or family's house out of town, a hotel, or a special needs shelter, there are certain things that they need to take with them, not only because of the pandemic, but because they are coming with their loved one with dementia and there's special needs that person is going to require. So I want to talk a little bit about that, because we can all take care of ourselves. We know what we need, but when it comes to the needs of someone we're caring for, it's a little bit different when you have to keep them safe and keep them busy in turbulent times. So what are some of the things that a caregiver should know to take with them if they did have to leave their home?
Well, even before they're leaving, they want to think about reducing that stress and confusion for their loved one. So you know how we all kind of focus on the Weather Channel as a storm is approaching and on the news. This may be something they want to moderate and not have the patient because they often show scenes from prior storms. The patient can be confused and think that that's going on at that moment and become very frightened. So you want to keep this kind of calm in the home as far as the news and the Weather Channel goes. And also, as you begin to prepare, things that you really can pack in advance and start to think about so that you don't have this last minute rush where you might be more likely to forget certain things, you can involve that patient and give your loved ones some choices, giving them some opportunity for control over what's happening. They may be able to make some selections of clothing. While we suggest simplify the clothing, bring things that are comfortable and loose. These special needs shelters tend to be very cold, so you want to pack some sweaters, even though it's August or September. But maybe they can choose. Wherever you can give them some ability to exert some control and some choice, that will make them feel part of the process rather than just something that's happening to them that they don't understand. Also, focus in on their skills, their interests, what types of things successfully redirect them in the home when they're bored. Are they puzzles? Are they cards? Is it an MP3 player with headphones? Is it a robotic pet? Is it a particular lap blanket that they feel comfort from? Make sure those things go with them, things that would connect home to the new location. And focusing in on those things that they enjoy and they will engage with. You want to get some of those things packed in advance as well. And again, they may be able to have some choice there. If they're on a special diet, of course, it would be critical that you have those products with you. Or if there are some things that really comfort them, certain snacks or beverages, maybe boxed, that are easy to bring. These are things you want to think about to have with you. Again, to make that connection from home to the new location and try to tamp down some of that stress of that change.
Well, those are really good ideas because you don't want to be without the blankie, as I call it, when you have a like a baby that they need that blankie and it's not there to comfort them. Same thing for adults with dementia. They do have certain things that they're used to, and you change their routine, and then you change a lot of things on top of that. It's going to cause them to be anxious and stressed out, which is going to make you anxious and stressed out at the same time. So those are great ideas. Palm Beach County, this county where we are in, is actually recommending taking not only your mask to the shelter because of COVID-19, but taking your own sanitation wipes and your own spray disinfectant to wipe down surfaces and soap, because I guess you don't know how long you're going to be in a place before you can return home. So, as far as the virus, to do that too. But what about other things like medication and documents?
Well, I'd like to mention a few things about medications right now, particularly because of COVID-19. If prescriptions are running down, of course, you want to fill them in advance. And if you're coming up on a year since that prescription was written, you may not be able to get a refill without a visit with that physician. So again, it's wise not to wait until we're in a hurricane or approaching a hurricane watch situation. Now would be the time to call that physician or nurse practitioner, alert them that you have prescriptions coming up on a year, and how can you get those renewed so you have an adequate stock if you do have to leave for a shelter, because some of these medications are absolutely life-saving. So it's critical to take stock of that now. It's difficult to get appointments in some cases. And so, again, not something you'd want to wait for too long. It is obviously wise to bring some of your own disinfecting supplies, hand sanitizer. If you have extra masks, of course, the cloth masks have to be laundered with some frequency. But whatever you have will help. The shelters will obviously be stocked with those supplies, with gloves, with masks, with sanitizer, but certainly not a bad idea to have some of your own as well. And we always advise making sure that you know where your insurance documents are, things that would be critically important if there was anything going on medically and you have recent lab work that could come into play if something should happen at the special needs shelter. There will be physicians there. It could be important to pack those and bring those with you as well. So again, now in the quiet time when we don't have a storm threatening us, this is the time to get those things ready so that if you had to pack them, they'd be ready to go. And maybe prepare a file so that you don't have to go through this every year. You've got that to-go file that has those critical documents. Of course, as you get new ones, for instance, new medical information, new lab work, you can refresh it. But continuing to keep that ready really does decrease the stress, because we need to remember that if you're preparing to leave, you're probably preparing your home as well to withstand the storm, or you're trying to engage others who can help you to do that. There is a lot going on when we're in a hurricane watch. And so the more you can do in advance, the more secure you'll feel. And something you alluded to about routine, our loved ones with Alzheimer's or related disorder really do best when they feel the sense of routine. They feel that they know the cadence of the day and they are in control. We have to remember they've lost control over so many of the things in their life. Wherever we can give it back, even if it's as small as the flavor of the particular snack you want to pack. Get them involved in that, because again, they'll feel part of the process rather than a victim of a process that's being thrust on them.
Right, right. One thing that you said, I want to emphasize the to-go file. Now, I know you've always been an advocate of the to-go file because people need to have that in emergencies, even in their own home. And one of the things that you've always said is make sure you have a current picture in that to-go file. A lot of people put it on their refrigerator in case, the person wanders off. So I want to remind everybody to make sure you have a current picture to take with you, whether you're going to a shelter or a hotel, because there are more opportunities for that loved one to get lost, because they do wander and they can get lost, and you want to be able to show this is who you're looking for.
Absolutely. And we staff the special needs shelter, and we actually bring a camera with instant photos. So if you don't have a photo, we will take a photo of the patient with the caregiver. We take the picture of them together, so that we know who goes together in case they get separated. So if you have one of those that's recent, great idea to pack that. And as you mentioned, that risk to walk off and become lost on foot in a huge shelter, they can become temporary lost or perhaps even get out of a door. As you may know, we have a very active program for those at risk to wander, and we provide electronic locator bracelets. We've been having this program for over 7 years. We've served over 1,000 people with these bracelets. And up until recently, we had about 80 elopements in 7 years. Every single person recovered quickly and uninjured, which is incredible. About 80. In the last
Wow.
couple of months during COVID-19, we had 30. And so after having 80 in 7 years, we suddenly had 30 in just a few months. These are patients who left their home unsupervised. Again, found quickly, returned safely, uninjured, largely because of that electronic locator bracelet process. But such an incredibly large number in a short period of time, we're looking at the impact of COVID-19 on the risk to wander, because it has really stressed all of us in so many ways. Again, it dominates the news cycles. Our routines at home have changed, and we're certainly looking at what that connection may be. So my point here is your loved one, even if they haven't wandered off before, we're seeing an uptick in this. And so it's a risk we consider an if, a when rather than an if.
And so it would behoove caregivers then to get the special ID bracelet anytime, but especially now during the COVID-19 hurricane threat. I mean, it's good for anything, and they can do that through your organization, right?
Absolutely, and we're proud to say it is a grant-funded service. It's provided at no charge to the family. So particularly if you've had a wandering event or a near miss, it's bound to happen again. So please feel free to reach out to us, because again, that's something we can provide at no charge. And the consultation to evaluate for that is provided by our team of family nurse consultants, also at no charge to the family.
All right, great. Well, we've had your name and phone number up on the screen for those who are watching us live, but for those that are listening on the radio or maybe on the iHeartRadio app, let's go ahead and give your number, the phone number, and the website where they can go on and check all this out. Would you give that to them, please, Dr. Gilbert?
Absolutely. Thank you. We serve Palm Beach, Martin, and St. Lucie counties here in South Florida. Our headquarters is in West Palm Beach, so you would reach us at 561-683-2700. And that number is manned from 8 to 5, Monday through Friday. And then we do have a crisis line for after hours, which is a toll-free number, 800-394-1771. And the after hours number obviously is not for a medical emergency that we urge you to call 911 very promptly, but it is for something urgent where you're having a situation and may need some guidance in how to respond to a particular behavior. We always have a family nurse consultant on call answering those crisis calls, and we can help you navigate through that situation. Our website is alzcare.org. That's ALZCARE.org. And there is a tremendous amount of information. You can read about the ID Locator program. You can watch the Lost on Foot video. And you can also see our hurricane issue of our magazine. Which was just came out for this season. It is designed to be kept for the whole year because it has some incredible information in it about what to pack, what to consider, and so on. So please do take advantage of that. It's available to read on the website anytime, and we're thrilled to provide that. As you see in the cover of the magazine, actually is showing one of our nurses taking the temperature of a patient arriving for daycare. So if I may, Marcia, for just a moment, I want to mention that we have 11 specialized day centers, 8 in Palm Beach County, 1 in Martin, 2 in St. Lucie, and within the next year, we'll have a 3rd in St. Lucie. And we are recognized as an essential service by the governor. So we were permitted to remain open through the pandemic. And we knew that it would be difficult and that we could encounter a COVID-19 situation. We are always very aggressive with infection control, particularly in flu season, because if our patients get the flu, they are highly vulnerable to contracting pneumonia and becoming critically ill. So we already have those mechanisms in place. So when COVID-19 came along, we had to only step up a little bit to increase the distancing to a 6-foot distance, to take temperatures every morning of staff and patients. We sent a tremendous amount of education home to the caregivers, everything that was published by the Centers for Disease Control and Prevention, the CDC. And we had everybody on board with what we were doing to protect our patients and our staff, of course. And for the first 5 months of this pandemic, we didn't have one case, not in our day center, not in our staff. There have been a couple since, but only a few and in different day centers, never more than one in a day center. And several of them were not even attending at the time. Their caregivers were keeping them home. So we're really proud to say we've done very well to control that environment in the day center. We did decrease the traffic coming in. We decreased our music therapists. Music therapy was now done on our smart TVs instead of live, and we discontinued our nursing student rotations. But that was a way, again, to keep that environment controlled and safe, decreasing the number of people coming and going. So as we ramped up to this potential hurricane threat a few weeks ago, we call all of our families. We make sure they've got that plan in place, and our family nurse consultants help them if they have some missing pieces. And then after the event, even though we were really so fortunate to have little to no impact, we call them again and ask them, how did it go? Was there anything you wish you had planned for that we could help you with next time? Any needs you now have as a result of that experience? So we really urge our families to approach hurricane season very, very diligently and to reach out for us for anything we can do to help them with that plan.
Wonderful. That's great. Thank you for that, Dr. Gilbert. We're going to take a quick break, and when we come back, more from Dr. Karen Gilbert about what you should know during the hurricane season and the coronavirus pandemic. We'll be right back.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to CareGiver Solutions.
I'd like to take this opportunity to thank our national sponsor, Arden Courts Memory Care Communities. Arden Courts is a leader when it comes to memory care because that's all they do, having about 55 memory care assisted living communities across the United States, 10 of them here in Florida. Arden Courts is a great resource, and they'd like to offer you a resource today just for tuning in to this program. It's called the 36-Hour Day Book. It's a wonderful resource written by Dr. Peter Rabins and Nancy Mace, and it is chock full of education, advice, explanations, definitions, anything related to dementia, Alzheimer's disease, and caregiving. So if you don't have this book, I would highly recommend you having it. And today it's absolutely free just for the asking. All you have to do is email and tell them that you heard about the offer on the Caregiver Solutions info show. That email address is delray@arden-courts.com. Again, email delray@arden-courts.com. And they'll be happy to send this book out to you. Just include your name, address, and telephone number and email them, and this book will be on its way to you. It's a really good resource to have. And if you don't have it, and even if you do, maybe somebody else doesn't have it and they might need it too. So feel free to reach out and share, because this is what it's all about, is sharing and caring. And we want to be sure that everybody has the education and the tools they need by having all the guests on the show like we do, and the wonderful experts giving all their information, and things like this, a great resource. So email today. If you don't have access to your email, you can actually call a toll-free number, and that number is 888-478-2410. So now back to our program. My guest today is Dr. Karen Gilbert. She's Vice President of Education and Quality Assurance with the Alzheimer's Community Care, located in many counties throughout South Florida and headquartered in West Palm Beach. We're talking about the coronavirus now joining forces with a potential hurricane. We have the season, we're in the midst of it, things are changing. And you did mention the magazine, Dr. Gilbert, before the break, and I held it up. But I want to emphasize how, I guess, informative and useful this magazine is, because it actually features information directly about the virus and the hurricane season. And if someone can get the magazine, or they can go on your website, which is alzcare.org, and download this magazine and read it, it actually has wonderful charts on here that you can check off, what you need to take with you to a shelter if you go, special things that a person with dementia would need in a shelter or during a hurricane. Should you evacuate or stay? It has a chart that lets you know, is it better to stay or is it better to go? Family contact information, very important. What documents that you need to take with you, a list of medications that you can write down, and information on the special needs shelter, and much, much more. So again, this is a great resource too. It's absolutely free. You can get it from Alzheimer's Community Care or their website, alzcare.org. So this is something that we want everybody to avail themselves of, because it is so important to be prepared. And what have we said, Karen? All the years that we've been working together, and I've known you for about 19 years, be prepared. Caregivers need to have a plan and be prepared. I mean, more now so than ever, but always be prepared. Even if you don't have to execute that plan, at least you have one, right?
Exactly. And there's something else. Thank you so much for talking about a hurricane issue. But there's the very practical, like making sure your vehicle, if electric, is fully charged, or if gas powered, the gas tank is full. Securing things within the home if you're leaving. And then again, as you say, if you're staying, what's critically important. But there's something else that I'd like to mention with regard to COVID-19 and hurricane season. We have heard for a long time now that the traditional symptoms of COVID-19 are fever, cough, and shortness of breath. That is not necessarily true for older adults. Older adults with or without a neurocognitive disorder are likely to display COVID-19 symptoms differently. And that mechanism of displaying symptoms could simply be they're not themselves. There's just some change in their behavior. Perhaps it's their sleep routine. It could be their appetite, their mood. Something changes. So my point there is, if you're seeing any change in your loved one, and we do have a storm approaching, you really want to get that medical evaluation, because if it should be COVID-19, you don't want to be in the special needs shelter. You want to be in a place where their medical needs can be addressed, because they could become emergent. So we've known for a long time in our adults that we don't wait for fever. We are guided by a change in behavior, because again, we know that our patients are happiest when they are in a routine, and they love their routines, they love their activities. When something changes, we know that something has provoked that change, and it is usually an emerging medical condition. The most frequent are urinary tract infections and general pneumonias. That's the most frequent. But now we also know that that change could be COVID-19. And with so many of our patients having diabetes or high blood pressure, we're not wasting a moment. We call the caregiver, they get evaluated. Now, as I said, the vast majority of patients that we had seek medical attention did not have COVID-19, but they had something else that needed to be addressed. So if we're ramping up to a storm, be really tuned in to what your loved one's usual behavior is, usual appetite, usual sleep pattern, usual personality, usual level of engagement and activities, because if any of those change, do not hesitate. Do not wait for fever or cough or shortness of breath. Understand the change in behavior is really speaking to you and telling you that something's going on. It could be an adverse reaction to a medication, but that too needs to be addressed by the physician or nurse practitioner.
Those are great tips. I've known about the UTI, but you guys have firsthand knowledge day to day during this pandemic, watching the needs of your patients in the daycare centers change. I want to also let everyone know that you had told me earlier that Some of the centers are accepting new clients because you do have room. So, you are essential, and it certainly is essential for the caregiver to get that respite. It's essential for the patient, the person with the dementia, to have their routine. So I want to encourage people that if you're super stressed out during this pandemic and you're overwhelmed and you just can't do it anymore, check out the ACC day centers, because possibly they could help you during this time and ongoing. So thank you for that. You mentioned about getting medical treatment. Do you have any advice to someone who finds themselves having to take their loved one and them being admitted into the hospital either during this coronavirus time or during the threat of an oncoming hurricane? What would they do?
Well, in general, we try to see that our patients are taken care of in an outpatient setting. We have wonderful hospitals. We have incredibly dedicated nurses, physicians, nursing assistants, but hospitals do not get education in the care of patients with Alzheimer's and related disorders. There's nothing required for hospitals. And so they often really do not understand the behaviors that they're seeing. Now, when a loved one can be there, they can inform the nurses, well, if dad starts to yell, it's because he's hungry. I know that behavior. But you can't be there now during COVID-19. And so if your loved one does have to be hospitalized, if they should sustain an injury or develop a serious illness, you've got to start thinking about how you will get that unique information that you know about your loved one to that nursing staff if you cannot visit. Now, you can call, you can fax, you can deliver a document to the main entrance and tell them this has to go to the nursing station for my loved one who's in room 350. They need to know this information. They need to know that your loved one may not be able to manipulate those meal trays, and he just won't eat or drink unless he has help. They also need to know that he may not remember to ring a bell and wait for help if he needs to go to the bathroom. And so there's a very high likelihood that he will fall and be further injured. And again, you would think this would be simple, but it's not. The family has the best information about that patient. We have to remember also that Alzheimer's and related disorders present differently in every patient. Every patient is unique. They're unique as their fingerprints. It's not one disease. The brain is a very big landscape, and depending how the misfolded proteins are traveling around the various lobes of the brain will determine that person's deficits. They're all different. And so the information from the family is incredibly valuable. We want to make sure that your loved one is not medicated for a behavior. We want to make sure the behavior is recognized as a need to use the bathroom, a need to have a drink, a need to just be reassured, just to have some gentle touch and be reassured. And you've got to figure out how you'll get that information to the hospital when you can't be there. And that's been one of the major tragedies of this illness. We've heard this over and over across the country, that families couldn't be with a critically ill loved one when that's probably what they needed most. So this is why we say when you see a change, act early, because there's a much better chance that whatever that is will be able to be treated in the home and will not require hospitalization. If you delay, you often wind up in that situation at night or on the weekend where your only option is the emergency room. And it's not the best option for our cognitively impaired loved ones.
Yeah, ERs, emergency rooms, even being admitted to the hospital has never been great, for anybody, especially for people with dementia. But now with the coronavirus in the hospital too, and the staff there, they're stressed out, and it's just kind of scary. You want to try to avoid that at all costs. But good advice from you, Dr. Gilbert, with getting that information. And that would work for rehab centers too, wouldn't it?
Absolutely. Patients are vulnerable to the same issues in the post-acute setting. And so often when they've been in the hospital for pneumonia or for a fracture, they are transferred to a skilled rehab. And so again, the more information that can be translated across the system, the safer your loved one will be. And the staff really loves getting that information from the family. Because they know it would take them a long time to interpret those behaviors. If your loved one wears glasses or uses a hearing aid, make sure they have it in the hospital or the rehab setting, because if they're not seeing well and they're not hearing well, they won't do as well. They're more vulnerable to a syndrome we call delirium, which unfortunately in this country is unrecognized up to 80% of the time. And if they experience delirium, which is just a sudden change in their behavior and their level of confusion, and it's not resolved in that hospital experience or rehab experience, it will recur. So delirium will become an acute issue repeatedly over time, increasing the risk that your loved one will be rehospitalized and the cycle begins all over again. And we know that patients who experience untreated delirium do very poorly, and in a year's time are actually more likely to pass away. So the more we can prevent that from happening, the better. So again, the more the staff knows about your loved one, the more your loved one is prepared to see well, to hear well, and has assistance for eating and toileting, the better they will do.
That's all great advice, and those are good things to put in that to-go file. We talked about earlier all the different characteristics of your loved one, their likes and dislikes, their behaviors, and to put in that to-go file, not only make sure that they have their glasses and hearing aids with them when they go to the hospital, but put that information in the to-go file so that the staff is aware that they do have them, because you and I know that there have been times when, gee, goes in the trash for no reason and they're lost and no one even knew that they had them in the first place, and now they're out with the trash. So if someone is aware, they can at least look for them if they're not there, and hopefully avoid costly repurchasing of hearing aids and or someone not being able to hear and causing its own problems.
Absolutely. I would encourage caregivers, now's a great time to write down some of these specifics about your loved one. When my mom asks for her mother, don't tell her her mother has died. Just because your loved one might be 90, when she asks for her mother, you ask about mother. Because when short-term memory fails, we know that our loved ones are more successful when they're thinking about an earlier time in life. So your loved one might still be thinking she's 50 years old and mom's alive and well. And we call that validation. You don't want to keep correcting and trying to reorient them to the here and now, because they don't have that capacity to understand what's going on now. Much safer in that earlier time. But again, our hospitals, with all good intention, will try to reorient the patient to the here and now, and might say something like, well, you're 90, so I don't think your mom is around anymore. That's a brand new trauma. It's as if they're hearing it for the first time. So we want to tell them, if this occurs, just ask her about her mom. Ask her to tell you her mom's name and where she lives. And we call that redirection and validation. And it's very therapeutic, because maybe your loved one just needed to have that feeling of mother, talking about her for a few moments, not literally calling mother on the telephone. So these are simple things. If you know it about your loved one, put it on paper, have it ready in the event that they need care in another setting other than your home.
You know, you mentioned earlier that hospital staff really aren't educated much, if at all, on dementia and the symptoms and behaviors of it. And I've always thought that there should be a section within a hospital just for dementia, so that it could be secure, so that people could be trained, so they would know, what to do, how to do it, and how best to communicate with those patients that are suffering with some form of dementia. It hasn't really happened. I know of a couple hospitals around that have attempted to do that, but overall it's not. And wouldn't it be wonderful one day if that were the norm, if each hospital, with the tsunami of Alzheimer's and dementia happening now with the baby boomer generation, it would be an awesome thing if there were special place within the hospital that could care for somebody with those special needs.
Well, one
You
of
can
the
work on
problems
that.
is, well, we could, but people are hospitalized for different reasons. So one might be an orthopedic issue, one could be a cardiac issue, one could be a pulmonary issue. So you're going to have patients in different specialty areas of the hospital. We as adult day providers have to provide 8 hours of initial education for our staff with a minimum of 4-hour updates every year. We actually do 12 hours minimum every year. But hospitals aren't, and that's in Florida statute, that's in the law. Home health agencies only are required to have 2 hours and no required updates. Nursing homes only 4 hours and no required updates. And hospitals have no requirement in Florida statutes. So this is why we have that education gap. Again, we have wonderful hospitals and incredibly dedicated and great practitioners, but they can't know what they've never been exposed to. And so we have to be the ones to advocate for that appropriate care of our loved ones in that setting. And we're moving that way. We do our specialized day centers and ID locator and family nurse consultant, but we're also out there advocating for change so that every healthcare professional, your dentist, your chiropractor, your physical therapist, everyone should have that same baseline of education and know how to answer the 90-year-old patient asking for her mother. We all need to have that same education.
You're absolutely right, and I hope it comes to that. We're going to take a quick break. We'll be right back.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to CareGiver Solutions.
I've been talking to Dr. Karen Gilbert with Alzheimer's Community Care. Dr. Gilbert, thank you so much for being on the show today, sharing all your expertise, talking about the hurricane preparedness, the COVID-19 things that we need to do and know. You're a wealth of information. We love having you. I hope everyone takes advantage of everything you've had to share. I just want to recall everyone, owlcare.org for your website. Call them at 561-683-2700 for more information on anything that you heard Dr. Gilbert speak of today. I hope you stay safe and stay well, Dr. Gilbert, and thank you again for everything.
Thank you. Thank you so much for having me. Appreciate it.
All right, you all take care out there. We'll see you next time with another great show next week. Remember, CareGiver Solutions info show and iHeartRadio under WNN. You can tune in either way. the website at caregiversolutions.info or on the iHeartRadio app. So take care, everyone. Stay well. We'll see you next time. Bye for now.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teele. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions.